All right, this is Unit 5, Section 4, and we are going to talk about special concerns of pregnancy. This lines up with Chapter 6, Section 1 in the book. After this lesson, you should be able to describe the 3 of the most common ART procedures, recognize possible drawbacks of fertility treatments, compare and contrast the 3 different types of multiple pregnancies, explain 2 complications of pregnancy, and 3 congenital conditions. For many women trying to become pregnant, the course of events is to conceive a baby within a year. For some people, however, fertility becomes an issue. The fertility rates in the U.S. are declining for 2 reasons. These reasons include trying to conceive after the optimal time for childbearing and having reproductive organ damage that's usually caused by STIs and other high-risk behaviors like smoking and consuming alcohol, taking harmful medications, and using illegal drugs. Thus, women and men wanting to conceive undergo fertility treatments. Closely connected to fertility treatments is the rising occurrence of multiple pregnancies. When fertility treatments include hormones, the ovaries are stimulated to overproduce mature eggs, resulting in multiple pregnancies. Similarly, just before the end of a woman's reproductive years, the ovaries may produce more hormones for a few months, resulting in multiple pregnancies. All right, infertility and sterility. About 94% of all couples who try to conceive will do so within a year. Couples who try to conceive and are unable to do so within a year are known as infertile. If a woman loses pregnancies over and over, it's also called infertility. About 40% of infertile women do not want children. About 2/3 of infertile couples wanting children will conceive if treated for fertility. The remaining couples will not successfully conceive because one or both partners are sterile. Being sterile means the couple is permanently unable to conceive or the woman is unable to carry their biological child. People often think that women account for almost all fertility problems. In 1/3 of the cases, infertility is due to the woman. In another 1/3 of the cases, it's due to the man. The remaining cases are caused by a combination of both partners or by unknown reasons. When both adults are infertile, they have a much lower chance to conceive than couples with only one infertile partner. Reproductive diseases and problems with the reproductive organs are the main causes of infertility and sterility. Certain diseases like diabetes and some prescription drugs, such as those for high blood pressure, may lessen fertility. Being exposed to drugs, chemicals, and radiation can interfere with fertility as well. The same is true of sexually transmitted infections and smoking. Excessive physical activity, being overweight or underweight, and aging can also lead to fertility problems. Infertile couples who want to seek having biological children can have fertility counseling. Fertility counseling, a vocab word, is a medical evaluation that seeks to determine the reasons for fertility problems and explores possible treatment options. Tests are given to determine the problem. If a problem is found, the doctor may suggest steps to restore fertility. Assisted reproductive technologies, or ARTs, which is a vocab word, are methods infertile couples may use to help them conceive. The most common treatments include using hormones or drugs to stimulate ovulation or balance hormone levels. Sometimes surgery is used to repair problems with the reproductive organs. If these treatments cannot correct the problem, then other methods may help infertile couples conceive. The following are the 3 most common ART procedures. Remember, you should be able to describe these. Artificial insemination, which we also call intrauterine insemination, occurs when the sperm is introduced into the vagina or uterus by a medical procedure rather than by intercourse. In vitro fertilization, or IVF, occurs when one of the mother's eggs are surgically removed and fertilized with sperm in a petri dish, a laboratory dish, and after a few days, those fertilized eggs are taken and implanted back in the mother's uterus. And then gamete intrafallopian transfer, or GIFT, occurs when a mixture of sperm and eggs is placed in the woman's fallopian tubes where fertilization can occur. Because more than one egg is present, conception is more likely, but a multiple pregnancy can occur too. In some cases, problems exist with the sperm, eggs, or both the sperm and the eggs. For example, one or both partners may be sterile. When these problems exist, couples may opt to use an ART with the germ cells, sperm, eggs, or sperm and eggs, donated by other people. These donor cells would be used to attempt conception, usually through IVF or GIFT. If the wife cannot carry a baby, the couple might consider using a surrogate mother, or a woman who bears, and sometimes both conceives and bears, a child for a couple. The surrogate would carry the baby in her uterus, give birth to the baby, and then sign her parenting rights over to the couple. She would conceive using ART with the wife's eggs, or donate her own eggs if the wife's eggs cannot be used. Some other ART methods, so artificial insemination we talked about, it's used to provide increased number of sperm for conception and also used to impregnate a surrogate mother. Some problems are there's a slight risk of infection. If the sperm is not the husband's, moral issues and legal issues can arise, like the legitimacy and the biological father's rights. Hormone therapy or fertility drugs, they stimulate the ovaries to function properly. Some problems are multiple pregnancies and possible increased risk for female cancers. Microsurgery is an attempt to open the fallopian tubes. Some problems are the risks of surgery, like anesthetic and infection risks. In vitro fertilization is used to allow a woman with permanently blocked fallopian tubes to have her eggs surgically removed and fertilized with her husband's sperm in a lab dish. After a few days, the fertilized eggs are put back in her uterus. It's also used to impregnate a surrogate mother. Some problems are risks of surgery and multiple births, and there are also moral and legal issues to deal with. Gift increases the chance of conception if men have a low sperm count or women have problems ovulating. The problems are risks of surgery and multiple births. And then a surrogate mother is used to replace the infertile couple's role in bearing a child. A surrogate mother may bear a child who is the infertile couple's biological child, conceived by IVF, or may bear a child with her egg in the husband's sperm of the infertile couple. Or she may bear a child not biologically related to the infertile couple by using her own eggs and donor sperm, introduced through artificial insemination. Some problems are there are moral issues and legal issues to being a surrogate mother. So, of all the fertility treatments that we just talked about, why do you guys think that artificial insemination, IVF, and gift are the three of the most common ART procedures? So I want you to think about that. There are many drawbacks to fertility treatments, so you should consider the following possible drawbacks before undergoing them. Fertility problems can be emotionally painful for couples. Couples may also feel their privacy is violated during fertility testing and treatment. If one partner has the fertility problem, he or she may feel damaged, flawed, or guilty. Only about 50% of couples having treatment succeed after one treatment. Older couples often have the least chance of succeeding. Treatments are very expensive. Additional expense may be incurred traveling to major hospitals for treatment. For some couples, ethical issues are involved with the use of any ART. For many couples, ethical, legal, and biological issues are involved when the donor and egg sperm are used or if a surrogate mother bears the baby. Because of these drawbacks, many couples choose not to pursue their options regarding ARTs. Others try but find they cannot restore their fertility. Both types of couples may face or experience a crisis as they adjust to this reality. For some people who deeply desire children, there may be a lasting sense of being unfulfilled. Counseling may help them resolve these feelings. Many other couples become fulfilled parents through adoption or foster parenthood. Some childless couples find fulfillment in other endeavors or attempts to achieve plans and goals involving families and children. All right, what are multiple pregnancies? Sometimes two or more babies develop in the same pregnancy. We call that a multiple pregnancy. Multiple pregnancies are less common than single pregnancies. Note, twins are more common than triplets, and triplets are more common than quadruplets. As many as 7 or 8 babies can be conceived in the same pregnancy in very rare cases, if you remember, like Octomom. Doctors are often concerned about the health of multiple births with 3 or more babies. Most babies in these births are born early and have low birth weights. A low birth weight is a weight under 5.5 pounds at birth for a single birth and under 3.3 pounds per baby in a multiple birth. This puts them at risk for severe vision, hearing, intellectual, and developmental disabilities. Twins are also almost 5 times, and triplets are 10 times more likely to die in their first year than single birth children. All right, so types of multiple pregnancies. Twin type or multiple type refers to the classifications of twins and larger sets of multiples. The most common way to describe multiples is by zygosity, whether the multiple is developed from one zygote or more. Types of multiple pregnancies include fraternal births, identical births, and higher multiple births. The most common multiple pregnancy is caused when multiple babies develop from 2 or more eggs. Each egg is fertilized with a different sperm, which means each child has a different genetic makeup. These babies are as much alike and different as any other brothers and sisters. Children born in these multiple births are called fraternal births or dizygotic births. Okay. Multiple ovulation, when more than one egg is released, makes fraternal multiples possible. Multiple ovulation is due to hormones that stimulate ovulation. If you have a history of multiple births in your family, do you have a better chance of having multiple births? Yes. If fraternal multiples were born on your mother's side of the family, you have a better chance of having fraternal but not identical births because the production of extra hormones is hereditary. Okay. The most common type of fraternal birth is fraternal twins. Fraternal twins represent about 3/4 of all twins. Fraternal children may or may not be the same gender. Of these fraternal twins, 25% are female pairs, 25% are male pairs, and 50% are female-male pairs. Fraternal twins can be as alike or as different from any two single-born children in the same family. They often look different at birth and show greater differences as they mature. In identical births, which we call monozygotic births, children develop from a single egg fertilized by a single sperm. Before the zygote embeds in the uterine wall, the ovum splits to produce 2 or more children. Scientists do not know why the ovum splits. Heredity does not seem to contribute to monozygotic births. Identical twins occur in about 1/3 of multiple pregnancies. Thus, the chances of identical births are much less than the odds of fraternal births. Babies from an identical birth have the same genome. Because identical children are very similar in appearance, people often confuse which child is which. Even family members may confuse them. Except for their genes, identical children are not exactly alike because their epigenome creates some differences. Their fingerprints, palm prints, and footprints are similar but not exactly the same. Also, environment makes identical children different. For example, one child may be larger because of better nourishment even before birth. Some identical twins are mirror twins. They look the way you and your mirror image would appear. For instance, one may have a birthmark on their right shoulder and the other may have one on the left shoulder. One may be right-handed while the other is left-handed. If the ovum does not completely split, the babies will become conjoined twins. The bodies of these twins are joined in one or more places. They may share external body parts such as legs or internal organs such as the liver. Conjoined twins occur in about 1 in 250,000 live births. Okay, higher multiple births. Higher multiple births, 3 or more babies born to one woman from a single pregnancy, are sometimes called super twins. In these higher multiple births, the children can all be identical, all fraternal, or mixed, with some being identical and some fraternal. Of higher multiple births, most are mixed type births, where 2 or more babies are identical and 1 or more is fraternal. If all the children are identical or fraternal, it is not a mixed type birth. If mixed types of pregnancy, separate sperm fertilize 2 or more eggs. Okay, so that's fraternal. Then 1 or more fertilized ova may split. That's identical. Triplets are often from a mixed type pregnancy with 2 children identical and 1 fraternal. Quadruplets are often from a mixed type birth. With quadruplets, there could be several combinations of fraternal and identical children. Any mother can have pregnancy complications. Some pregnancies, however, are considered high risk because of a great chance of complications. High-risk mothers include teen mothers. Older mothers are also at greater risk for complications, and their babies are at an increased risk for abnormalities compared with those of younger children. Multiple births are high risk, especially higher multiple births. Finally, any mother-to-be that's not in good health before pregnancy has an increased risk of pregnancy complications. Pregnant women can greatly reduce the chance of complications in their pregnancy by receiving prenatal care, following their doctor's advice, and practicing good health habits. Complications can occur, however, in any pregnancy. There are some major complications in pregnancy that we'll talk about. Complications can damage the mother's health, and some can result in congenital conditions or the loss of the baby before birth. Prenatal care helps doctors note problems early, which allows for early needed treatment. Some possible pregnancy complications include an ectopic pregnancy, which is caused by a blocked fallopian tube. Some symptoms you might get would be spotting and cramping. The uterus doesn't enlarge like it should. Your fallopian tube might rupture. Another problem could be too much amniotic fluid. Causes would be uncontrolled diabetes, multiple pregnancy, incompatible blood types, congenital problems. Symptoms would be excessive pressure on mother's body, some breathing problems, or congenital problems in the newborn baby. Too little amniotic fluid is another problem. Okay, causes are congenital problems, growth problems, death of a fetus. Symptoms would be fetal movement slows or stops. Bleeding in late pregnancy is another problem. Causes could be placenta abruptio, placenta previa, vaginal or cervical infection. The symptoms is going to be really heavy bleeding. Placenta abruptio is another problem. The cause is unknown. Occurs more in women who smoke or have high blood pressure, who have had previous children or a history of detached placentas. If they suffer injury to their abdomen or they're carrying multiples. Symptoms include bleeding, cramping, and abdominal tenderness. Placenta previa, it can be caused by, which is the placenta attaches itself to the uterus near the covering of the cervix rather than the upper half of the cervix of the uterus. And by the way, placenta abruptio is the placenta is detached from the uterine wall before it should. But the causes of placenta previa is scarring of the uterine wall from a previous pregnancy, tumors in the uterus, surgery of the uterus. It's more common among women who smoke or use drugs or are older than 35 or are carrying multiples. Symptoms would be bright red bleeding without pain or tenderness of the abdomen. And then pregnancy-induced hypertension is another problem, which we call preeclampsia or toxemia. Causes are typically multiple fetuses, teen pregnancy, or women who are pregnant and over 40 years old. High blood pressure or kidney disease are all some possible pregnancy complications. All right, some other pregnancy complications include congenital conditions. Okay, these may be inherited. They can be caused by environmental factors, or they can be caused by genetics and environmental factors. Okay, they happen with varying degrees of severity. The most common congenital conditions include cleft lip, which is noticeable at birth. The two sides of the upper lip fail to grow together properly. A cleft palate occurs when the opening remains in the roof of the mouth, and that creates problems in breathing, talking, hearing, and eating. Cystic fibrosis, which is a chemical failure that affects lungs and pancreas. You got some thick, sticky mucus that forms in the lungs, and it causes breathing problems. Diabetes, metabolic disorders that causes high blood sugar. The person feels thirsty, hungry, and weak, and usually loses weight. Down syndrome, where you get distinct physical features like slanting eyes, large misshapen forehead, oversized tongue, a single crease across the palm of each hand, and then varying degrees of intellectual disabilities are typical. Huntington's chorea, the brain and central nervous system deteriorate when the person is between 30 and 40 years old, causes involuntary jerking, loss of mental abilities, insanity, depression, and then finally death. And there's no treatment for it. And then hydrocephalus, is extra fluid is trapped in the brain. The person's head is larger than normal. Without treatment, children will not survive this. They have to remove the excess fluid with surgery. Muscular dystrophy, it's a group of disorders which damage muscles and they cause progressive weakness and then finally death. There's no cure. There is therapy and braces to offer some relief. PKU, the enzyme deficiency makes a person unable to digest amino acid. The baby is normal at birth, but develops intellectual disabilities because the amino acids build up in the body and cause brain damage. Sickle cell anemia, the red blood cells are sickle-shaped rather than round. They cannot carry oxygen efficiently throughout the body. People become pale, tired, and short of breath, and they have occasional pains. Their lifespan is shorter than normal. There's no cure for that as well, but there are some treatments to relieve some symptoms. Spina bifida causes partial paralysis and urinary and bowel incontinence, which means that you can't control your bowels because they have an incompletely formed spinal cord. Learning disabilities are also common. And then Tay-Sachs is a lack of a specific chemical in the blood resulting in an inability to process and use fats. It leads to severe brain damage and death, usually by 2 to 3 years old. So these kids don't live for very long at all. Okay, some other pregnancy complications include preterm birth. Preterm birth, a vocab word. It's a delivery that occurs before 39 weeks of pregnancy. Previously, a pregnancy of 37 weeks was considered term. Due to complications before 39 weeks, term is now considered at 39 weeks. Preterm births are higher for teen and older mothers and for multiple birth pregnancies. Some common factors are linked to preterm births, including having a family history of preterm births, a preterm baby in the past, the spacing between deliveries of less than 18 months, problems with the uterus or cervix, poor health habits during pregnancy, and late or no prenatal care. And then preterm delivery results in a high rate of death during the first month after birth. Preterm delivery can also result in a high incidence of brain disorders, cerebral palsy, chronic lung disease, and developmental delays. They also take an emotional and financial toll on families too. When a woman goes into preterm labor, the doctor can try several treatments to prolong the pregnancy. Some treatments work to prevent early labor, while others speed up the baby's lung development. Okay, loss of the baby before birth. A miscarriage is the expulsion of the baby from the mother's body before week 20 of pregnancy. That was the vocab word. The medical term for miscarriage is spontaneous abortion. About 50 to 75% of all miscarriages occur around the time of a woman's expected menstrual period. So she is unaware of the pregnancy, doesn't even know that she had a miscarriage. About 10 to 25% of all known pregnancies end in the loss of the baby. Most of these miscarriages occur in the first 13 weeks of pregnancy. And then although losses frequently occur for unknown reasons, some reasons are known. So some facts that are common causes of miscarriage is there's a chromosomal abnormality due to a damaged egg or sperm or not correct cell division of the zygote. The mother's age, if she's 35 years old, there's a 15% chance, 36 to 45, 20 to 35% chance, over 45, 50% chance. If she's had a previous miscarriage, if she has physical problems like hormones, infections, or other health problems, if her lifestyle, like she's exposed to health hazards like cancerous chemicals and stuff, and the maternal trauma, like she has an accident or an extreme stress like a loved one dies. Okay. Often the treatment for miscarriage occurring 10 to 12 weeks in the pregnancy is dilation in curettage, which is called a D&C. The purpose of the D&C is to remove small pieces of placenta that wasn't expelled during the miscarriage and to help control heavy bleeding. The 10 to 15 minute outpatient or inpatient procedure involves anesthesia followed by dilating the cervix. The lining of the uterus and its contents are then scraped with a spoon-shaped instrument called a curette, which prevents infections and excessive bleeding. Afterwards, drugs to control bleeding and antibiotics are given. A stillbirth, vocab word, is the loss of a fetus after 20 weeks of pregnancy. In a stillbirth, the baby is born dead. Stillbirths occur in 1 in 160 pregnancies. The main cause of stillbirth includes birth defects, problems with the placenta, bacterial infections occurring between 24 weeks and 27 weeks gestation, and the failure of the baby to grow. Several factors increase the mother's risk. Women who are 35 years or older, malnutrition, use of drugs, stress, genetic and chromosomal disorders of the baby, separation of the placenta from the uterus, which we call placental abruption, illness of the mother, so diabetes, liver condition, or blood clotting problems. Okay. A presumptive sign of stillbirth is when the mother no longer feels the baby's movements. That's possible that she could have a stillbirth. Stillbirth is often confirmed by an ultrasound. Babies who are stillborn are delivered either by induction, so they use drugs to start the labor, or when labor begins spontaneously. Doctors will have to make the call. Parents grieve over the loss of their unborn. Most parents cope with the support of family, close friends, religious groups, and professional groups. Couples often seek answers about the cause of a miscarriage or stillbirth to help prevent this in a future pregnancy. Having a miscarriage or stillbirth does increase the risk of another. With good medical care, however, many couples can conceive again and deliver healthy babies after the loss of a baby. All right, that is the end of Unit 5, Section 4. Thanks for listening.